Everybody rare to go for spare classes?
Finish my coffee meetings.
So, I'm really to the community health program, and we're supposed to be in Chep 2010 Foundations of Health Professionals. Okay, everyone's always have somebody that got a little favorite.
And that's okay. We'll figure it out.
Normally, when I big screen that's working, I don't know what's up. I didn't in this room last spring, so it's about a year, I'll figure that out before Wednesday.
So that we'll be able to see it. But if everybody able to log into the Blackbird space, okay. I'm going to walk y'all through that.
When I checked the list of students who are in this class, got a really good group of students.
We've got community health students,
we've got nursing students,
we've got psychology students, computer science students, graphic design students. I don't remember a CJ. Did I miss any other degree programs? One thing you're going to find out about
this course, any of the courses that I feel in the community health program, the skills that you learn are going to be relevant regardless of your degree.
Yeah, we may use the term health when talking in class, but everything relates back to health. Whether it's programming software,
well, we've got electronic medical records, we've got accelerometers.
Later this semester, my mother has to have what's called a Watchman implanted. That's relying on computer science. It's where computer science connects with medicine. All of those kinds of things are critically important. So we're going to work on those today. So when I use the term health, you keep a broad mind and an open mind about it. And if at any point you're going, how does this relate to my degree? Ask me. We'll figure it out. Don't stop me. Every once in a while somebody can, but it's pretty rare. So y'all give it a try. Any questions so far? So a couple of things about class. This is early. You are more than welcome.
Bring your breakfast. If you bring something to the stick with, just make sure that it has the lid on it so that you're not looking at the speaker.
The only thing I ask about food is that it's not loud. So don't bring potato chips because then we won't be able to hear. And it will catch. I record all of the lecture recordings.
So you have classes that you can leave for. You can fast forward to the part where you're recording and then you watch the rest of it as soon as it gets posted.
And you don't want to just have to listen to the static. And if there's anything that has a really strong smell of fish, it's a little fish. I like fish. If you are allergic to anything,
please let me know.
I am not going to tell everybody, oh, so-and-so's allergic to it, don't bring it. Just tell them, don't bring it. And if you have an EpiPen or something, just let me know where it is in your backpack in case you do need it. I've never had bees get into this classroom, but I've had other classrooms where bees have gotten into there. You should have seen the sign outside the door. There's also one at my office. I have a very reactive asthma to any kind of scents. So cologne, perfume, essential oils, lotion, all that kind of stuff. Don't wear it, class. If you forget It's okay. Go someplace else. Log into the computer. I'm not going to be mad at you. Just don't come to class. Yeah. It's miserable and I can't breathe. And so that's just up there as a reminder. Let's see. Email me through the Blackboard email system. I know some of your professors don't like the Blackboard email system. I do. It lets me keep your emails with the class. Still check it almost as often as I do my Outlook. And I will actually respond faster in the Blackboard than you usually will get with an Outlook email. So please do that so that we can keep everything somewhat organized. Has everybody been in the Blackboard stage? Have you found the syllabus? Got some nods and some people going on. In the syllabus, it shows that my office number is 127. There's no in that area of the building, so we're not going to use that for a meeting. Typically, I would think office hours will most likely be in 121 of Hardway. So you all know where the Pepsi machine is on the first floor? No, some yeses, some no's. Okay. Go down to the first floor, either the staircases or the elevator. In that main hallway, you're going to see the Pepsi machine. Just across the hallway from there. That's probably right. Otherwise, I've got my Google voice number that y'all can text me and say, hey, I can't find you. Where are you? But that's usually where I'm going to be. And we can also meet virtually. In my under and Blackboard, the little links, little box. There is a link to the class name, so you're going to join through Teams. This is the first time I've used Teams for teaching. So, yeah, there's probably going to be some cussing at various times this semester, especially since they put the share button right beside the leave meeting button. So, if I'm ever lecturing and I suddenly disappear, and you're in the computer, just hang on, I'll be back. I just have to rejoin. Class activity space. When we have in-class activities, we do those in a digital space. So if you click on that link, you can do it now or not. It's going to take you to OneDrive. Or it should take you to OneDrive. Is anybody able to do that? Did you get an error message? Let's see what yours says. This list is, okay, well, let's just tell you access. What did the rest of y'all do who actually have computers? Okay, it lets you in. Okay, click. Scroll up. Critical links. And then you click your digital OneDrive folder. See what it does. So OneDrive has a mind of its own. Okay, it lets you in. No, that's it. You should be able to access it and you can put files in it. Now everybody can see the file. So don't put anything in there you don't want to see. You've got your own private OneDrive space, but this one's specific to class. So probably the next 2 weeks that I'm going to have, you're going to come into class and I'm going to tell you, open the OneDrive space, it's going to go class activity. that's where you go. If you are watching a recording, you are still expected to do that class activity. That's how you get your participation points for the course. Go ahead and check it. And you can get emails going, hey, it's been 3 weeks, you still haven't done your activities. What's going on? So make sure you do that. Look at it in class. So quite often at the end of Monday, we might start an activity, and I'll tell you, okay, go and work on it on Tuesday. Bring it up on Wednesday. Everybody knows what you've done your part. Make sure you do that. Okay. Let's see. The office hour information, the link for accessing the digital course savings for the lecture. You should not need the passcode, but put it there in case you get it in those 16s. Let's see. Registrars on calendar. I do have the calendar. Now you'll notice lecture recordings, slides, etc. I went ahead and uploaded some slides. If I'm looking for one or two today, we'll look at the rest of them on Wednesday. I will also upload this lecture recording to that space. So you'll be able to see everything together. Now, I'm not going to upload those slides with Wednesday, because they're already up there. So if we're using slides on a Wednesday, or even a Monday, if we had started it the week before, we may have to go down to an earlier lecture recording to find the slides that go with it. I typically put the most recent at the top, typically. Depends on how the semester is going. Okay. Has everyone, or most everyone, been able to look through the course things and kind of start looking at some of the modules? Mostly have not. To start here, welcome and course orientation. That one will be fairly consistent across all of the courses. That's one of the university puts in there to make sure you know how to use Blackboard and that you have access to university standard expectations of students. Now, I have a course introduction module that actually has assignments that are due this week. They're not rocket science. You should be perfectly fine doing them. If you open the course syllabus, it's got the usual instructions. And then on page 6. Yeah. On page 6, it's got the topics and due dates for this course for the whole semester. All of your assignments are posted in the Blackboard. And if you've got things going on, if you're traveling for sports, you know you're going to have to work extra for me because of the convocation. Some family members got a kid due, something like that. You know when these are due, plan ahead. This is the last day that you can submit them. You can submit them early. Now, there is one assignment that is on week 8. It says quiz lost children of Rockdale County. The library is helping you get that video back online. So that is the one that we may have to do with the video. Everything else should be fine. If we're getting close to the date and we haven't talked about the assignment, remind me. Make sure you understand it. I would rather go over
The
assignments build on each other. So if you miss an assignment early in the semester, it's going to make assignments later in the semester much harder. So make sure you stay on top of things. So even though this course is supposed to be face-to-face and high class, we do have a few discussions before we go on the computer. They're already posted. If you look at the bottom of that module, you'll see the discussion rubric. Make sure you look over that. That's what I'm looking at in order to issue you your grade. Make sure you address all of those things. Does everybody use APA format for references and citations? Yeah, mostly not. Okay, if you have not, you need to make sure you know how to use those. That's what I said, APA format. You're more than welcome to come and stop by my office, whether it's office hours or not. If you find me, just stop in and tell me you need some help with something. I'll tell you if I'm going to a meeting. It's okay. But I'll help you set up your APA references so you'll understand how to do that. And we'll also talk about it this week. The module titled The World of Health Promotion. You've got your module outcomes. So that just gives you an idea of what I'm expecting you to be familiar with by the time you finish this module. And then each week is set up in a similar manner. Now, week 1, you've got your syllabus prepared. Make sure you actually read the syllabus. And it's also some questions such as, do you work? Is there anything you need to know that may impact your performance and past this semester? I've had students, a student who used to drive down from Preston County. And because they drove a motorcycle, because it was such a far drive, made it very clear to the student that when you get a fall semester snow, you don't need to be in class. Anybody driven through Preston County in the snow? It's scary. I'm from Georgia. I really don't know how to do that. So, those kinds of things. I had a student tell me that they were actually going to deliver their child at like Thanksgiving. I was like, okay, we'll keep you posted. And we'll figure out the last 2 weeks closer to time. It happened. I had a student who worked to go night shift at the hospital, and then they go directly to work to class, and then they go home and go to bed. That's important to know, because if you've had a bad night, and you have some nights depending on what area of the hospital you work in, it's just helpful to know when you're kind of students out of sorts. This semester we're going to be using student reflection journals for a few of the assignments. I've never used these journals before, but I'll ever use them in class. Okay, so let me know how they go, and I'll see what happens when I start reading them. We'll figure it out together. Now, when we get down to lecture preparation, this is where you have a week assignment. You do not have to find a book for this course. Dr. Haynes, our community health professor, and I have worked very hard to get rid of as many of the purchased textbooks as possible. But we still expect you to actually read them. Outline the information. Your exams in this course are going to cover information in the textbook. We may or may not cover it in class. I don't teach for the textbook. I expect you to read that. And if you don't understand something from the textbook, you got to let me know, and we'll go into more detail. But what we talk about in lecture, and what you read about and study about in the reading materials, complement each other. They do not necessarily overlap completely. If you look at the lecture recording, if you look at the lecture preparation for week 1, you've got a couple of videos to watch, and you've got a couple of files to download. One of them says it's 35 pages long. You need to be prepared. You don't have to memorize this. I want you to read it and skim over it and use it as a reference. It's a lot of definitions. The other one is pages long, but you'll notice it's an infographic, so very small. And if you want to read that one in person, at least part of it is down by my office that we're not going to meet in. It's there on the wall. And then there's a couple of videos. There are, most weeks are also optional but recommended to you. I recommend that you download all of these materials as soon as they're available, because some of them, because of copyright restrictions, some of them are not going to be available all semester. So you have to download them, save them on a folder that you've labeled Chep 2210 in your computer so that you can reference them. That's one of the logistics of not having to spend $200 on a textbook. You actually have to download the files in a timely fashion. How many of y'all like doing puzzles? Got a couple, okay. So, energy balance activity is actually a puzzle. I'm so excited. Way too excited. Read the instructions, and then you're going to do this puzzle. Now, you might have to do this puzzle. I don't know. Oh, I thought you were going to say something new. But it is a puzzle. I love puzzles. The website is called Jigsaw Planet. You can create your own puzzle with it. I'll get anxiety or stress or something like that. I have cats, so doing physical puzzles doesn't work out very well. And then there's a discussion related to those two this week. Critical concepts. This is a file with definitions. You need to memorize these definitions. Some of them will be your midterm. All of them have the potential for being on your final exam. So as we go through them in class, make a note so you know which ones to memorize for the midterm. And then just know the rest of them will be on the final. And then there are also two links. One is health, and the behavior change series videos, especially the sections of the theories, the ecological model, the levels of prevention. We're going to be sick of those two by the end of this class. I've got graduates who still send me pictures. They go to meetings. They've been out of school for 5 to 10 years. And then they're like, there's that damn model again. Yeah, I told you, it's going to be everywhere. So just memorize it now. It'll be okay. At least it's not hard. Some of them can be a little bit more difficult. City training. Has anybody completed a city ethics training? You have? You think so? Okay. If it is still current, so it hasn't expired, just upload that certificate. Don't redo it. Okay. City training is a research ethics training course module that you have to do. And you're going to need it in, well, depending on your degree program, you're going to need it anywhere from probably 2 to every course. If you're in psych, you're going to need it in almost every course. Chep, you need it in almost every course. So, go ahead and get it done. Find it in Blackboard today. Start getting registered and start working through it. There are, I think, around 15 quizzes that you have to finish before you get your certificate. Fortunately, it's open. Well, last time I had to read my certificate. Right click on the start quiz, open the quiz and another tab, and it's opened up for you. Which is helpful because some of their questions are very nuanced. But you have to do that before you can do your plan for it and before you can finish writing your risk assessment paper. So if you do not do your city training, even if you get perfect scores on every assignment that does not require the city training, you're going to be lucky to have a seat. So this is a critical assignment. And the nice thing about it is it's good for 3 years. So you want to keep your certificate so that you can turn it in your other courses. Does that make any McW city training? No. She really did too. That's spring, so you want to keep your certificate so that you don't have to redo it. So we're going to start on that. If you have trouble, then come to class early. I'll be in here on Monday and Wednesday mornings. I get here sometimes around 8-ish, depending on how many deer run out front of me on the way to campus. And I can help you deal with the issues that you might be having. The screens for the city training might look slightly different than the ones that you see. So do a little bit of critical thinking, troubleshooting with that. But let me know if you have trouble with it. Now, the city training assignment certificate, you don't have to turn that in until week 2. The section about city training is in week 1. It's just go do it. But you submit it in the assignment area. So, who is a community health major? Okay. I'm so excited. What made you think about the community health program? What did you think about?
So I was a nurse, okay. But I was like exploring different options. And when I've always wanted to just get back to my. So I was for sure going in that. And learning like what it means to get back. So I just it was so really
we don't have so I told my husband he doesn't involved. He just loves to do stuff. Never wanted to be a teacher, I never wanted to be a nurse. So I'm just so sure. And then public health. So epidemiologist, yes. And we've got a couple of other classes that are coming up that you're going to thoroughly enjoy. If you want to do a research project, which is something that epidemiologists do, we'll figure out how to make that work within your course schedules. How about you? Yep. Campaign was very excited that you were considering it. I do not remember your name, but I remember her talking about it. Yes, maybe we can take it on. So good. First day, it happens. It always happens. Okay. So, community development coach. Are you community development coach? Psychology. Okay. So, psychology coach. Who am I psychology coach? Okay. Okay. So, what made you interested in psychology? Okay. Cool. All right. How about you? Well, I think I was 16 or 17. I started therapy in yeah, no, I totally get that. And talk about what wasn't she daughter and her son. And I'm sitting here like, I'm trying to tell you about right. The respect. Right. So, if anybody else is in that situation, I can feel it by somebody. So, that's. I've also seen school counselors like that, and I was like, never. I would never do that. But, yeah. How about you? My first one, I was not quite that center. I was and and I want to help people. Nice. Okay. I try to find kids grow, and I've been to work with humanities. It's hard. It's so, and what would work for me might not work for you or you. And it's figuring out. So what is your don't know yet. Okay, that's fine. Well, we'll have to sort it out as we go through it. So we've all gone through it. You are going to do a risk assessment this semester. So this is similar to a term paper. You may have written other courses. You're going to start out looking at statistics. Let me back up for a second. When you're reading or you're studying for exams, things like that, you do not need to memorize statistics in this class. You do not have to know that X percent of West Virginians struggle with obesity. I do expect you to know
West Virginia and Mississippi have two of the highest rates of obese in the country. But you don't ever know that number, that percentage. It changes too quickly. So make sure that you don't stress out about all the numbers that you see. They change by the time we finish the semester. But when you're writing your risk assessment, you will tell you X percentage of your community or your target population deals with this health issue, whatever that health issue is. So you're going to start off talking about that. Now, several of the psychologies of nature infant how to figure out how the mind works. That's kind of why I'm in the social work of public health. My area of public health is not epidemiology, but my specialization is in social behavioral public health. So it's getting into that kind. What makes people do things they do? I've had majors go on to get their degrees in epidemiology. If you want to talk to her, I'm more than happy to connect you. But you're going to identify some of those risk factors for the condition that you're researching. It could be for risk factors for developing the disease. It could be challenges that are faced managing the disease. It depends. It depends on what your topic is, how we word it. And then towards the end of your risk assessment, you're going to give us some suggestions. You're going to be the expert in the room. And so you're going to tell us what are some things that the research says needs to be done to address the issue, and then how do we go about it? How do we go about it are the logic models that you're going to develop. Now, if you go and you look through the course and you look at the section about logic models, some of you are going to go, it's going to be okay. We spend a lot of time working on them in class. They look very intimidating when you start working on them, but they're not. They're simply putting that puzzle together. They're organizing it so other people know what's going on. So if you look at those and you think, oh, I don't know how to do this, you're not supposed to know yet. Even when we get to the end of the semester, you're going to know just a small fraction of logic models. But it's going to be a heck of a lot more than other people on this campus, including employees. So don't let that intimidate you. What is a topic that you find interesting? Nutrition. Okay. Let's, if you're going to do your research topic on nutrition, what topic is it? Would you like nutrition? So let's see what everybody else is thinking. What do you think you might like for a topic? So keep thinking. How about you? Keep thinking too. How about you? Okay, so how do diseases adapt? So what I'm going to do right now usually makes students just go really it's called blind or similar. It narrows down to a topic that you can actually do in a 10 to 12 page paper. So what diseases do you find most interesting? Okay, colds. The virus is actually in the same family as COVID. So it could be really vice versa.
So, and whatever you mentioned today, you're not stuck with it. You're not stuck with it until you start doing the brainstorming assignment. So don't worry if you start this and then you start looking into the research and you think, oh, what is it? So, how the cold mutates and impacts people. So what population do you think? What age group?
Probably those of where outside or like yeah.
Okay, so those are going to be like
Types of communities, okay? So something that I would tell you to do over the next week or two, and this is for everybody, it's not just you. Go into PubMed.gov, and you're going to start researching that topic. See what you can find. Now, for cold, that's a word. That's easy enough to search for us. Rural children, you would want to put quotation marks. Because it's helping you to look at that phrase or that term and instead of the individual words. Make sense? And see what you find. And then let us know. I'll talk about this more. I have to. You have to think. Okay. That's good. No, it was a great topic. You just leave it around. But it's, you could write everything for dissertation or scratch the surface. How about a topic that you find interesting? Okay, so schizophrenia. So what population?
Where will I be?
You tell me.
Older, like when I had that CD I will see a lot of kids.
Okay. So what do you know about schizophrenia already? Okay. So it's definitely something about how your brain perceives things around individuals. And individuals are typically diagnosed in their teen years, early adulthood. I actually did schizophrenia in my developmental class back in the 1990s. So, I found out the hard way. This was in 1993, 94. Schizophrenia and new diagnoses of schizophrenia in the elderly, like over 60, very rare. It's usually those teenagers and those young adults who are diagnosed. But if you are living with schizophrenia and people have had it for decades, you might have that older brain. So you want to do some research. PubMed, Google Scholar. So scholar.google.com is another one that you can use. And you can also use the library search engine. So you might want to see what's out there about challenges for the elderly population who have a diagnosis of schizophrenia. Well, you may say, I'm not going to do that. That's just too complicated. But that's why you do all this research right now to figure out what it is you want to do. What do you think of it? Sociopaths. Okay. Tell me a little bit more about it.
Just the different ways their minds operate.
Okay. So how they put their minds together. So are you looking at sociopaths that have become serial killers or sociopaths who become CEOs?
Probably.
A mixture. Okay, you probably want to see what's available. Because there is a balance between what you want to do and It's just the logistical issues of being a student still. I've never had anybody do that pathway, so that'll be interesting. So you can find about it. You may also want to ask some of the psychology faculty. Dr. Williams, because she has clinical psychology, she might have some ideas for you on researching it. Look at the assignments, both the key informant interview and the risk assessment assignment. They have questions that you need to think about when you're writing your paper. So they are questions that you need to think about when you're researching your topic that you should find enough. Now, in the key informant interview, this is a good chance for me to mention this. You are not, the likelihood of you interviewing somebody who actually has that diagnosis is probably zilch. But what you can do is interview people about their perceptions about individuals who have that diagnosis. Same thing with an individual with schizophrenia. Chances are you're not going to interview somebody who has schizophrenia because it is a typically rare disease, rare diagnosis. But you might interview somebody who works in an organization that works with individuals with schizophrenia. Or you might know somebody who has a family member or a friend with schizophrenia, and you might interview them. So when I say key informant, it is somebody who is somehow familiar. They could work in the field, they could have the disease, they could know somebody with the disease, and in some cases it could be perceptions of the general population that's somehow connected. Yes, you can do as many interviews as you want. You are required, I don't remember if the assignment says you are required to interview one or two, but you can interview more than that. The other thing with your interview, you do not have to give me their real name. You can create a pseudonym. So basically you pick, or let them pick a name and put it in quotes, and that lets me know that's a fake name. I don't know exactly who it is. Some of you will be talking about topics that you may not be making public, and that's okay. Last fall, I had students researching. So one student was researching postpartum depression. So she interviewed individuals who had experienced postpartum depression. I had an individual who was researching challenges faced by children who aged out of the foster care system. So again, they may not have wanted everybody knowing that they had aged out of the system. I had an occupational safety student. This was the first time I had an occupational safety major. And I just found the topic absolutely fascinating. She researched the perceptions among firefighters related to using personal protective equipment. Apparently, there's a problem with firefighters not wanting to use their breathing apparatuses because they think it makes them look weak among their peers. Seriously? Yeah, it is like, and those individuals, they did not want their names out there in writing associated with what it is they said. Well, that's really going to help. So I don't think all about. Do you think of anything?
I was thinking about doing something with health disparities.
Health disparities?
Especially in marginalized groups.
Marginalized groups? You probably want to pick a specific organizer.
Yeah.
And if you have trouble finding stuff because of so many websites that have gone down, let me know. Okay. And so, yeah, that is a disclaimer I do need to give, is if you go and click on a link and it's wrong, you're going to let me know immediately. There have been a number of websites, like I taught this class last fall, I'm teaching it this fall, and in between there's been a lot of websites that have just flat disappeared. I've tried to correct them, but I don't know if that's going to continue, so you'll need to let me know. And if you find that you're having trouble finding, you start struggling to find something, let me know, and I'll help you. We're in a situation where I don't know the decision-making process behind some of what's disappeared. But we'll do the best we can with it. Okay. So, now leave here, go open the city training links, register, and start that training. And I will see you on Wednesday.